this is the common approach. On top of the tree is where our body is divided into different body parts. This is an excellent approach when you're managing diseases. But like I said, we don't manage disease, we manage the health of an individual. So we look at our body not as different parts of organs, but we look at our body from a systems biology approach. So conventional medicine is very strong in using pharmacology, pathology, and anatomy. We use different kinds of science. We use physiology, biochemistry, and the biology of the human body. So looking into the imbalances that is present in that particular individual, imbalances could mean deficiency, or imbalances could mean toxicity of a particular substrate. So I always compare, this is a standard talk for me when I talk to patients about our practice. I always compare our body to a car. So our car is also running because of a system. And this system will require certain substrates in order for the car to run efficiently. So like our car needs gasoline, water, oil, battery, and even the air of the tires. So if any of these substrates are deficient, sooner your car can still run, but not as efficient. And sooner or later, that car will break down. The same thing with our body. Our body requires vital substrates as well in order for it to function efficiently as a system. Our body requires, of course, micronutrients, macronutrients like fats, proteins, carbohydrates, and then of course we need hormone balance, we need antioxidants, we need enzymes in order for the different physiologic and biochemical processes to run efficiently in order for us to function optimally. So, but many things could affect the balance of this system. And here are there at the bottom of the tree. That's why it's called the root causes of illness. And these are what we call determinants of health. But the determinants of health could also be, if it's compromised, could result for it not to being a determinant of health, but rather being the root causes of illness. So, aside from being the why medicine, we also try to practice, we also call the upstream medicine. So, well, most of the time, diseases, when they start manifesting with symptoms to an individual, that is already the latter part. Because, you know, our body, its organs, is capable of organ research. So at times, our body will always try to achieve a homeostasis or balance until such time that it can no longer uphold that balance. That is the time when we start manifesting with symptoms. And sooner or later, when investigated, that is when it results to a diagnosis of a disease. But it's not enough to just simply diagnose a disease. It's important also to know the story behind that disease. Why this person developed this condition, or why several complications happen continuously despite the fact that they're being managed effectively by doctors who practices illness medicine. So, next. So, like I've said, nutrition is very important as a vital component to optimal health, because, as mentioned, it's medicine, it's connection, it's information, and food is energy. So, combine this nutrition, this nutrient-dense, balanced, real, optimal nutrition, combine it with adequate, quality, restful sleep, combine it with fitness or exercise, and combine it with restoration. Because our body requires, we have the sympathetic nervous system. If it's too much and you don't have your parasympathetic nervous system, then that could also result to imbalances as well. And of course, it's very important for us, especially nowadays with modern living. Everything is convenient, escalator, travelator. They're considering now sitting as next to smoking because sitting can kill. Movement is important. So these are what we call determinants of health. But the problem is the Filipinos have the worst health habits in Asia, according to a survey. In fact, while waiting for my turn, somebody passed in front of me a big leche flan. And I have nothing against that, but I think simple sugars, maybe you need to determine the allocation of your macronutrients. Like what you said, balance is the key because we are a system. So we have the worst unhealthy eating habits, the least number of sleeping hours a day, spending 5 hours a day in traffic. Me, I live 10 minutes away from life science, but when I go home, it takes me 2 hours sitting in a car, listening to a lot of podcasts. So, highest level of preventable medical conditions, but the most optimistic. We are actually, right now, according to data, we're #1 as far as breast cancer in Asia. Okay. So next. So how do we determine nutrient deficiencies? Especially if this could be the root cause why a person have all these chronic diseases. So this is where we use biochemical and metabolic studies in our practice. So we need to measure. Just like in conventional medicine, you don't give your medications unless you measure. So there's also what we call advanced functional diagnostics to determine at the cellular level, not at the organ level, whether our cells have its complete necessary nutrients in order for the different physiologic and metabolic processes to happen efficiently. So, but at times, lifestyle choices can rob us of these vital nutrients, and I'm guilty of this, especially the first one. So, because sometimes we borrow energy from coffee, from caffeine. So sometimes we think it's just a habit, but actually, with daytime sleepiness or fatigue, those are indicators of an imbalanced system or deficiencies of certain vital nutrients. Alcohol, there's nothing wrong with it. I'm not looking at you, Chris. So, there's nothing wrong with it. In fact, we know that it has resveratrol, okay, a phytonutrient, but sometimes too much, like I said, we're a system. Anything in excess is not good. Anything deficient is also not good. Or sometimes people would want, especially Filipinos, we're so much into quick things. We want immediate. We want something that is very visual. So when we see somebody losing weight from this weight, so we think that it's going to work for us as well. But we have our biochemical individuality. So not that this particular food component is good for you, maybe good also for another person. So we need to determine what does your body needs. So that's why personalized nutrition is important. So next, so like I said, Philippine Health Profile, the probability of dying between ages 30 and 70 years from the 4 main non-communicable diseases, particularly heart disease, cancer, diabetes, is, what, next slide please, 28%. So the thing is, most of it are related to nutrition. So most of it are related to nutrition. So of course, with polypharmacy, with a very fragmented practice of our healthcare, polypharmacy is an acceptable norm, which we also know, or even our colleagues from the conventional medicine also know, that this could deplete our patients of necessary nutrients or vital nutrients. A classic example is, of course, statins. It could reduce your coenzyme Q10, which is a very important antioxidant for our heart muscles. As well as vitamin D. And we know that vitamin D is not just a vitamin, it's actually a pro-hormone. It's actually needed for cell signaling. So, but a lot of us are scared of the sun. We put in sunblock. So, but we need vitamin D. So next, as well in our clinic in life science, we not only like I said, we don't treat their disease. We also have clients who do not have any illness and yet do not feel optimal. So we have athletes who's wondering why they're not losing weight despite the fact that they're very physically active. So that is where we realize that many factors could affect metabolism. So it's not just the weight that we should be checking, but as well as other factors that could affect our metabolism. So but how do we assess? So, well, we measure. So you can actually measure all these substrates already. When we were in med school, when we were training for those doctors, all we were trained for is just the organ-based testing, the ones that tells us whether there is already a disease. But many of the people nowadays do not yet qualify to be having a diagnosis of a disease and yet do not feel optimal as far as their health is concerned. So it's good to measure. So you could measure your antioxidants, you could measure your B vitamins, which is basically the energy vitamins, which is involved in so many biochemical processes happening in our body, most especially for energy metabolism. So next, we could also measure, well, we were talking about the gut. Dr. Nigel is here. We know that the gut is very important when it comes to our health. In Ayurvedic medicine, death begins with the colon. So, because there's such a thing as a science called gut immunology. Because we know that 70% of our immune system is in our gut, not only in our bone marrow. So this is also an organ wherein we absorb nutrients. This is also an organ that we excrete. And also in this particular organ, which is called the second brain, actually reside trillions of microorganisms. We are a cellular organism. We have 50 billion cells in our body, but we have somebody occupying there 100 trillions of microorganisms. We call them the microbiota. So how is this? Because many factors could damage this microbiota or this microbiome from the time that we're born. So factors that could affect it, of course, too much intake of antibiotics, our diet, excessive simple sugars or diet, even stress could affect or damage the balance in this microbiome. So it's important to know, because if we really want to be healthy, these are the ones that is helping our body absorb the nutrients from the food that we are eating. Because even if we're eating organic foods, if the organ of absorption of all the nutrients that your body needs is not that effective and efficient in its function, then you still remain to be nutrient depleted. Of course, like I've said, our gut is our second brain. In fact, 75% of the neurotransmitters that our body produces comes from the gut. No? And it's used by our brain as a chemical for us to communicate. So neurotransmitters such as serotonin, dopamine, acetylcholine, as well as GABA or gamma aminobutyric acid. These are all vital chemicals in order for our brain to communicate the entire body. Okay, so that's why it's associated with conditions such as depression, fatigue, sleep disorder, these things. So it's good to measure the different components that makes up how we can remain healthy. So of course, we were talking about food intolerance testing. Okay, so because most doctors think of the gut only as an organ of absorption, as an organ of digestion or excretion of waste. But our gut, like I've said, is very important for optimal level of health, because our gut, like I've said, contains 70% of our immune system. But our gut is like it's like a cheesecloth, wherein it allows passage of the nutrients but repels the entry of toxins. If this particular membrane, intestinal permeability of our gut is damaged, then that could lead to certain foods not really harmful to us, but sooner or later, especially if it's an ultra-processed food, our immune system could react to it, because that is how our immune system was designed for, to protect us, to recognize whether this particular substance is a friend or a foe. And a classic example, of course, is gluten sensitivity. So, of course, stress. Nowadays, with traffic, who's not going to be stressed? I mean, but we know stress is not only limited to our environment. Stress is not just physical, it's not just psychological, it's not just emotional, but even our cells get stressed. You could measure it. So how do you determine whether you have the adequate antioxidants? Remember, our body, because of environment, because of certain things that we go through on a day-to-day basis, produces free radicals. These free radicals results to premature aging of cells, which later on results to premature diseases. But our body is capable of neutralizing this production of free radicals from pollutions and everything. But how do our body do it? Through antioxidants. But do we have adequate antioxidants? I mean, where do we get it? Of course, again, from our food. So like I said, vitamin D is not just a vitamin D for the bones. Actually, like I said, it plays a lot of roles, especially for cell signaling. So, but we are a tropical country, but of course, in our country, being the BPO call center capital in Asia, our 24 hours is no longer just simply day and night. To some people, their day is our night, and our night is their day. So they are not getting any or adequate amount of sun. So that is why it's no surprise that a lot of Filipinos are vitamin D deficient. But is this being measured? Well, no, and not unless it results to a conditions that will affect the bone health. So, of course, it's also important not just to determine, like I've said, about metabolism, but as well as your body composition. It's not only about the weight in numbers, it's also important to measure your muscle mass. It's important to measure your visceral fat, because this visceral fat is one of the most dangerous fat. Because it's a metabolic organ. It could be the one that could lead for what we call a condition called insulin resistance, which is the beginning of diabetes. So insulin resistance happens decades before our fasting blood sugar becomes abnormal. So, but why is nutrition so important? Because nutrients play a crucial role in daily energy production and performance, for disease prevention, or even for, like I said, for optimal level of health, and of course even for healing. So this is our cell. You've studied this in basic science. Okay, so next. So those are what we call mitochondria, the powerhouse of the cell, the battery. Do you know that these are microorganisms as well? So this is where the energy production happens. Yes. So how do we produce energy from our food? So there, remember this, the Krebs cycle. So the Krebs cycle, do you memorize that acronym? So this is how. So from fats, we convert it, because most of the macronutrients that we eat has to become energy. Most especially, for example, for carbohydrates. For it to become energy, it has to go through this path, okay, to this pathway twice in order to produce ATP. But do we have all the vital cofactors that our body needs? Are we getting it from the food that we are eating? Especially if the food that we're eating is ultra-processed or fast food, or this is what we're feeding our kids. So then, our energy production is not going to be negative. So that is why sometimes we tend to overeat, because you know that you're eating the right kind of food, the nutrient-dense food, if even after 4 to 6 hours you're not hungry. But if you're eating simple sugars, you notice it. After an hour or two, you're already hungry. Hence, you have to eat. So you're eating the liquid calories. So, and of course, if the efficiency of the system is affected by the absence of the vital cofactors, then, like I said, those glucose will not be converted into energy. Okay, and then will result to, of course, our body has to protect us. Those glucose has to be converted into fat. So like I've said, food is medicine. I'll just emphasize it. Food is connection. Food is information to our genes. And like I said, food is energy. So this is where we focus in our practice. Not just nutrition. It's important. A lot of people think that weight is just about the amount of calories and the amount of calories burned and the amount of calories taken in. That is based on the law of thermodynamics, but that law could only work for a machine, but not for a very complex biological systems like our body. Okay. So this summarizes everything that I've been talking about. So we start with a very hyperglycemic, high-fat diet. And if you follow it on the right side, you see it results to what we call metabolic endotoxemia. And down the line, it would affect, this particular kind of diet will affect what I said a while ago, the microbiome. No? It will affect, which later on affects the intestinal permeability, the gut barrier dysfunction, which later on could stimulate our immune system. And then that one there is actually our adipocytes, or our fat cells, wherein because of the effect of the components on this what we call pro-inflammatory diet could result to growth. We call it the diet-induced obesity of these fat cells. And then, of course, with this metabolic endotoxemia, it leads to stimulation of our immune system. Remember, the inflammatory response is the protective response of our immune system. which later on leads to a cascade of systems, which leads later on to this, what they call cardiometabolic conditions, like obesity, diabetes, and what they call the metabolic syndrome. So I'll just breeze through the other determinants of health because there's so many slides, but sleep is important. But how many of you are able to get 8 hours of uninterrupted sleep? Can I see a show of hands? 8 hours of uninterrupted sleep. Impossible. Okay, but there's a reason why there's a number attached to it, right? Because there are stages of sleep. Well, this is an American data. I hope we get to have our own data as well as to how many. Maybe it will be comparable with this one, but this is the data of the Americans. Next. So consequences of disturbed sleep. It has on emotional responses, on cognitive responses, on somatic responses. So sleep is vital as well. So nutrition is important, but like I've said, we have to balance all of this. But adequate sleep, restful sleep is also important. So the impact of sleep on glucose. So sleep abnormalities are causally linked to impairments in glucose homeostasis, metabolic syndrome, and type 2 diabetes. So sleep deprivation affects our cognitive function. Okay, next. Even associated with psychiatric conditions such as depression. So fitness, next. But the problem is we are very sedentary. So less than half of patients receive clinical counseling on physical activity. Anybody here who knows how to give fitness prescription to your patients? Do you know how to give fitness prescription? Like, of course, your patients will ask you, Doc, I want to exercise, but I'm scared because I just had my bypass. Should we stop them from exercising? I know a lot of patients who come to me and said the cardiologist is preventing them from exercising. But like I've said, even exercise. But nowadays, I'm happy because there's a movement called exercise medicine in the Philippines. So it's personalizing it. It's just that is what is important. So worldwide physical inactivity accounts for 6% of global burden from heart disease. So 7% of type 2 diabetes and 10% of breast and colon cancer cases. But what if there were one medication so powerful that you could prevent all these diseases? And what is that medicine? Like I said a while ago, exercise is medicine. So all of that will impact it. So next. Okay, so benefits of movement. This is just a study. Okay, so this is. Well, exercise also has to be, like I said, customized. If it's too much as well, it's also not going to be very beneficial. So it also has to, that's why it's important to determine as well the physical activity that your patients will take in, or else it will also lead to problems. So movement is different from exercise. Like I've said, nowadays, sometimes we find ourselves sitting for 6 hours, 8 hours in a meeting. You know? So that is a problem. That's why they're saying that sitting is next to smoking. So what's killing us there? Aside from tobacco, that's why they say sitting is next to smoking, because literally it is, right? Next, what is sedentary lifestyle? Well, not participating in at least 30 minutes of moderate intensity physical activity at least 3 days a week for at least 3 months. Because sometimes if I can't ask a patient to exercise, I prescribe what they call lifestyle exercise. Ask them to walk as much as they can. Don't use the elevator. Using the stairs in his office, and his office is on the 15th floor. So every day, and he lost a significant, because he said, I don't have the time to go to the gym. So going up and down, he uses the stairs. So what is sedentary behavior? So there. Sometimes we consider this as a form of relaxation, right? But actually it's not. So somewhere something went terribly wrong. So next. Okay. Well, like I said, vitamin D is important, but the problem is with so many products preventing us, especially Filipinos, we want to be fair, no? So we want to be fair. So we're applying a lot of sunblock, which is also not good. So next. So lifestyle exercise, like I've said. So these are examples of it, which you could provide, which you could recommend to your patients. So NEAT is non-exercise activity thermogenesis. So like I said, walking. These are very basic. So walking meetings, this is an example of it. So tomorrow, Chris, can we do this? So walking meetings, yeah. So next. Now there's a lot of treadmill desks. So I'm requesting from this one. So treadmill desks. So that one. So or you have this, so you don't have to be sitting the whole time. So you're standing. That one. So you can try that one. Or this one. So your posture. So you know that there's already an app that corrects your posture. So it will sound, or if your posture is you're slouching. So this one is also a good option. So like I said, balancing it as well with how we restore our body. So not so much predominance of the sympathetic, but as well as the parasympathetic. At least even for 10 minutes a day, if you learn how to breathe properly, you meditate, these are all. This will all make a difference for us to remain healthy. So how much time are we going to have in 78 years? So there. So 28.3 years sleeping, 10.5 years working, 9 years of TV, video games, social networks, Facebooking, no? 6 years of doing chores, 4 years of eating and drinking, 3.5 years of education, 2.5 years of grooming, 2.5 years of shopping. I think this is not enough for some women. So 1.5 years of child care. I think for my wife, this is not enough as well. We have 5 kids. So 9 years left. How will you spend it? So maybe you could answer that later. So 82% of office workers log into work at least once every week. Jason, outside of regular work hours. So more than half log in every day. Only a third of agree that they have a good work-life balance. So we know that there are different elements to achieve what you call a sense of well-being. So one of them, of course, is the love for the work that we do every day. Our physical health, our, of course, our financial security. Okay, of course, the love for the family that we have, and as well as the love for the community that we have. But to some, it's not really that balanced. So, next. This is a study, overtime in breast cancer. So it involves about 116,462 cancer-free workers followed for a mean of 10.8 years. 4,371 developed cancer. So working more than 55 hours per week associated with 1.6 for Zoe. So next. Overtime, strokes, and coronary heart disease. So compared to working 35 to 48 hours per week. So stroke risk was dose dependent. So please dose dependent down. So next. So those who do not laugh, do you have an office mate like this who doesn't laugh? Like who doesn't laugh at all? So this is a study that you should give to him or her. Next. So yeah, just peaceful. So meditation to focus and quiet the mind, promote relaxation, build internal energy or life force, develop love, patience, and forgiveness, and achieve better health. So mindfulness practice leads to increased brain gray matter density. So this, if you know Zig Ziglar, the proponent of mindfulness stress-based reduction program. So this was done, I think, in monks. Next. So multitasking, who are you here are multitaskers also, which increases your cortisol level, which would have an impact on your metabolism, would have an impact on your thyroid health. So that one. Next. So the solution, like I said, balance this one. So sleep, exercise, movement, and then restoration, and of course, optimal, balanced, real, nutrient-dense nutrition. So lifestyle is a choice. So although sometimes it's hard to make choices, especially if you cannot find foods that would nourish your body, right? So next. So, okay. So this is a common question that I'm asked all the time. So doctor, what should I eat? Do I need any vitamins to be healthy? And all? Like I've said, it's best to measure. Nowadays, the recognition that disease can be prevented, that disease, that we are not doomed by our genes, that even that aspect with regards to disease development is already, we have the information for that. Well, in life science, we do assess for gene testing, no? Or genomics. So, which would tell you your predisposition to whether you will develop a particular condition. But like I said a while ago, we know that we are not doomed by our genes. No? All this will be expressed, factors by our lifestyle will express our epigenome. So this is what we try to do. We assess the body systems and the balance of substrates. No? Many patients are here, we could still bring them there. Okay? And like I've said, at the middle, like I've said, since we are a system, deficiency and toxicity of something would both compromise our health. So like I said, test to catch the root causes of conditions. No? So if you wait for the downstream manifestations of disease, like for example, you wait for the SGPT level to go up before you could determine whether that person is predisposed to alcoholic liver disease, then you're going to be in for a surprise. So it's good to measure upstream markers of diseases. Okay, so you can also measure how healthy is your gut. Especially there's a condition called small intestinal fungal overgrowth, which would manifest with psychoneuroimmunologic conditions. Personally, I suffer from this condition, and I've been treating my condition for 2 years already. But it's improving. I suffer from chronic fatigue. So we could actually, measure that and determine that. So vitamin D, like I said, is not only a vitamin, it could prevent so many conditions with adequate, or predisposure to many conditions if you have vitamin D deficiencies. So this is what we do and we practice functional medicine. So we want to change the way we do medicine.